We talked about traveling yesterday in fasting. Today I have some questions here about use of medicine in the state of fasting. Number one, Mustafa is not feeling well. And so somebody said, well, you're fasting, but because you're not feeling well, just drink medicine, it's okay. So he ate or drank the medicine. Would his fast be valid? Huh? Even though it was because of medicinal reason? The answer would be invalid. You can't fast, you can't eat and drink and say, I'm still fasting. Although people are looking for that kind of fatwa. At least we can drink water. Means that's what people say. It's not that I'm mentioning that. Be careful about it. Number two, Sakina is fasting, but she needs to use the puffer or inhaler for her asthma. Her fast is valid or invalid, or she has to do qaza and kafara? Huh? Valid? It's valid with one notation here that most of the Maraji allow that because the way they look at it, that we have two passages here. One is the food passage, which goes to the stomach. Other is the air passage, which goes to the lungs. And the puffer inhaler, basically when you do that, it doesn't go to the stomach, it goes to the air passage, to the lungs. However, Ayatollah Khamenei has a different opinion. He considers that to be problematic in fasting. So he says you can still continue the fast, but if you are able to do qaza, means if your asthma is not that serious, for example, you do qaza in winter time when the days are shorter, then you should do that qaza. If not, then you're exempted. Number three, Hamid feels very weak. The doctor uses IV drip to administer nutrition in him. His fast is? He didn't eat or drink. Huh? Are you sure about it? It's void. Is it different from invalid? No, okay. Yusuf was given antibiotics through a drip. His fast is invalid? It is valid. So what is the difference between third and fourth? Look at it again carefully. Tell me what is the difference. Number 4 is the medicine. Number 3 is substitute of food and drink. So number 3 makes it batil, whereas number 4 is medicine administered not by mouth, but by IV drip, and that would be okay. Number 5, Kulsum uses a nasal drop or eye drop while fasting. Her fast is? Sure about it? There is a condition with it. It's not that simple. It is valid provided you don't feel it in your throat. Because the nasal, passage and eye and this throat, these are all connected. So if you put the drops in and you don't feel anything in your throat, you're okay. But if you feel that, then your roza would not be valid. In case it is not valid, do you have to do qaza or qaza and kafara? You just have to do qaza because it was for medicinal reason. Number 6, Ahmed goes for a blood test while fasting. His fast is valid or not? Huh? It is valid. because it's coming out, it's not going in. So there's no problem there. Okay?